The COVID-19 pandemic has shattered the once tranquil lives of many families. It has been particularly unforgiving to older people with pre-existing medical conditions. In South Africa, the virus has infected more than 2.9 million people, with the official death toll close to 90,000. Many of those who succumbed to their symptoms were caregivers and parents.
At the beginning of this year, my father got sick with COVID. Him and my mother both got so sick that they had to go to the hospital.
25-year-old 𝗶𝗿𝗶𝗴𝗶 and his 14-year-old brother 𝗃𝗏𝗍𝗆 were dealt a heavy blow when their parents, 𝗶𝗵𝗂 Sr. and 𝗃𝗵𝗂, tested positive for COVID-19 in January 2021. 𝗃𝗃𝗂's condition deteriorated days after the couple was admitted.
My father called me and said she's not doing so well. My father, he told me she just passed away.
Heartbroken and reeling from symptoms, 𝗶𝗿𝗏𝗆's father discharged himself from the hospital.
He couldn't handle the pain and everything, so he went home. When we had the funeral for my mother now, he was even so weak that he couldn't stand up to come to the funeral.
The day after the funeral, 𝗶𝗿𝗏𝗆 got a call from his uncle telling him to go home and check on his dad.
When I got there, I was just lying there on the ground. I was sitting, basically. Sorry. Yeah. And, sorry. Yeah, then he already passed away when I got there.
𝗶𝗿𝗏𝗆 is now the primary caregiver for his epileptic brother. They're both living in the home of his girlfriend, 𝗀𝗍𝗍, after their parents' home was repossessed. But the 𝗶𝗿𝗏𝗆s aren't alone.
Over 3 million children are orphaned in South Africa, and they need adoptive or foster care. Finding a good, loving home has always been a challenge, but the COVID-19 pandemic has exacerbated the problem in unprecedented ways.
According to Professor 𝗀𝗚cie𝗿𝗆, when a young child loses a parent or a caregiver, that child not only deals with heartache, but also with insecurity and doubts about the future.
I looked up the most recent data. Already 135,000 children in South Africa have lost a parent to COVID-19.
Talk to us about the impact of watching a parent or a caregiver get sick, then they die, and you're alone in the world, and you're just a child.
This is something that many children in South Africa have already experienced. You know, we've been living with an HIV pandemic for many years now, but what we actually see is the impacts of losing a parent are different for different ages. But what we're also seeing in COVID-19 is that around 65% of those orphaned are teenagers. They're between 10 and 18 years old. And actually, that is one of the most vulnerable times to lose a parent.
Those young people who've lost their caregivers to COVID-19 are lucky to be taken in by relatives. Others are absorbed into the child welfare system, while many are left to fend for themselves, like 𝗶𝗿𝗏𝗆 and his brother. 16-year-old Sandile Ncumalo and her two siblings are being looked after by their aunt Edith after their mother Ethel died in July. Sandile's mom died at the family home after she'd been turned away from hospital. Edith is concerned that the memory of seeing her mother's lifeless body on the bed they once shared will haunt her for some time to come. Though her father is still alive, Sandile feels like an orphan because he has had no hand in her upbringing, making things harder for her aunt who has a child of her own.
It's not that easy. It's just a matter of, I think love just keeps me going. Like, I love them.
The truth is, children grieve too. They may not have the words, but they feel the pain. So, you watch a parent get sick and they die, and you're left alone in the world. Now, if you're a child, how do you begin to make sense of that?
Professor 𝗀𝗚 says grief counseling is especially important for COVID orphans, as death often strikes in a matter of days or weeks, leaving little time for a child to process a parent being ill, let alone dying.
Children's behavior is often their way of expressing how they're feeling. And there'll be so many times when you see a child who is shouting or screaming or hitting. They're doing that because they're feeling desperately unhappy inside.
The professor advocates for the integration of children into the extended family as opposed to orphanages, but admits it's not always an option.
Sometimes a family falls apart and starts fighting after someone has passed away.
Financial challenges may also mean that some families simply cannot afford to take in another member. Many children are raised by guardians, including grandparents, adoptive and foster parents. And when they die, the grieving children have nowhere else to turn, but are hurled into the welfare system, explains 𝗀𝗃𝗿𝗆 from Johannesburg Child Welfare.
Generally, is the public open to fostering?
They are. There are challenges, though, that are faced because initially the screening process, which means then it makes it a delay for us to place children with foster parents, because until we are sure that a person has been properly screened, we cannot place children.
The number of successful placements has decreased drastically.
People are losing their jobs, the economy, so having to take on new mouths to feed, some people are reluctant to do that, and we have more children that we need to place.
Professor 𝗀𝗃𝗿𝗏 emphasizes that identifying and caring for children orphaned by COVID-19 should be a necessary and urgent aspect of government's response to the pandemic.
We need to make sure that that family gets parenting support, but that they get support in how to support the child, but also how to cope themselves.
As bad as things seem now, the story of COVID has been one of so many unknowns. It's been a fast-moving target, and we're making up the rules as we go along. So with the number of orphans set to rise, there's no clear indication of how many people will be impacted in the long run and how much those children will still suffer.
𝗏𝗏𝗀 says taking care of 𝗃𝗏𝗏 is a huge responsibility, but it's one he is proud to execute with the help of his girlfriend.
I've been doing my best, as I can, as I haven't been a parent ever, so everything's new to me.
And Sandile is slowly adjusting to life without her mother.